Okay, good morning, everyone. Welcome to an orientation to DMHAS Resource Link, State Education Resource Link, aka SERC. We're very excited to bring this information to you here today. My name is Jen Jacobson. I am with TTAS, the Connecticut Prevention Training and Technical Assistance Service Center, as your host. Before we begin, I'm just going to provide a little bit of overview on the broader connection prevention ecosystem here in Connecticut. We do get a lot of people who attend our trainings that might be from out of state or not necessarily a part of the prevention ecosystem. So we find that when doing these trainings, it helps set the context and where this resource link sits between the national, state, regional, and local level. So I'll just give a really brief overview at that before we turn it over to our esteemed guests this morning. So navigating Connecticut's prevention infrastructure. This is about connecting your work to Connecticut's substance use and problem gambling prevention ecosystem. The Connecticut Prevention Infrastructure is a multi-level system consisting of the national, state, regional, and local community level, and you will get these slides as well. At the federal level, you may be familiar with some of these agencies and organizations. We have SAMHSA, which is the Substance Abuse and Mental Health Services Administration Agency. SAMHSA's Center for Substance Abuse Prevention, which provides leadership and collaborates across sectors to advance prevention across the lifespan. CSAP aims to prevent initiation of substance use, prevent progression of substance use, and prevent and reduce harms associated with prevention use. There's also the CDC. At the state level, we have several prevention resource links: Problem Gambling Services, today's guest SERC, ourselves TTASC, Connecticut Clearinghouse, CPIS, and the Governor's Prevention Partnership. So that is the state level resource links. At the regional level, we have our regional behavioral health action organizations, which is our 5 RBHAOs, and those organizations are coordinating the prevention infrastructure within their areas of our state. That's Catalyst CT, Alliance, CRAC, Amplify, and Western Connecticut. The regional hubs for prevention planning and support. They conduct assessments and set regional priorities and bridge local initiatives with state resources and strategies. And just in case you're unfamiliar with those geographic areas of our 5 RBHAOs, there is a map here included for you that you'll receive that shows which towns and communities belong to which RBHAO. And then finally, we have our local level, which consists of our local prevention councils and our community coalitions. And these are the community level pillars of prevention and the infrastructure. They collaborate with 12 sectors, which are different groups and organizations within a community to address our local needs, to equip communities with the tools for substance use prevention, and then empower local solutions through mini grants and tailored strategies that fit the needs of those communities at the local level. So just a broad overview of the federal, national, regional, and local levels of the prevention ecosystem, just to provide the context of where our guests sit today before we begin with them. So with that, what I would love to do at this time is introduce our two guests, Bianca Irizarry and Malik Champlain from the State Education Resource Center. And with that, I will turn this over to you both to introduce yourselves and share all the wonderful things happening at work with us today. Thank you.
Okay, great. Once again, thank you, Jennifer, for having us here today. I would like to introduce myself. My name is Malik Champlain, and I am here with my esteemed colleague, Bianca Irizarry. If you know anything about Bianca, I am the Robin to her Batman. So she is phenomenal in all sorts of ways, and I'm always excited to have an opportunity to present with her, especially around this lunch and learn and orientation into what SERC is about. Bianca, do you have anything to say?
No, well, thank you for that introduction, Malik. I recognize some people here, some people I don't, but again, Bianca Irizarry. I also coordinate the School-Based Prevention Center, as well as being a consultant with Malik and doing all this work that we're going to tell you about today. I was happy to have this opportunity. I think it's always great when we get to expand information on SERC and the position that we are in the state and what we do, because it's very complex, nuanced, and we do many things. And so to have the opportunity to bring that information out on a bigger scale is always nice. So we appreciate that. And also how the school-based prevention center fits into all of that. So happy to be here today with you all and with Malik, who I always enjoy.
Oh, awesome. Awesome. So today's session is designed really to give you a comprehensive overview of SERC. And SERC stands for the State Education Resource Center. And we really want to just really talk to you about how our work intersects with prevention, education, and equity across the state. You'll learn about SERC's history. We're going to talk about our mission and vision. We'll talk about specific services that we support and that we offer to schools, families, and community partners. So whether you're new to understanding what SERC is, whether we've collaborated prior to this, we're really hopefully you're interested in learning more and going deeper with us, and maybe even partnering with us, obviously in the future, in our equity-driven and centered work for change. And but just a quick reminder that look, the chat is a great place to use your voice if you don't want to unmic or anything like that. If we have any questions for you, but please take notes, use the chat, ask questions. There'll be time at the end, hopefully, for us to have a little bit of if there's any questions that you have or discussion. But our number one goal is not just to present information, but hopefully we're sparking some ideas and inspiring some meaningful collaboration. So with that being said, all right, let's build community before we dive into content. We're inviting you to reflect on this prompt. What recently has unexpectedly brought you joy? Something that has brought you joy. Like I said, please use the chat. But this question it's more than a question, just kind of warming us up and reminding us of the human side of the work that we do. In prevention, education, and community engagement, it's easy to get consumed by the challenges. But we wanted to talk about the joy, right? And how that connects to our purpose. And how that joy is worth protecting. So Bianca, do I have anybody in the chat talking about what brought them joy recently?
Yes, so we have a new dog, the weather, making light and laughing when faced with unexpected challenges. So there's some of what I have here. Creating a scholarship for a clinician that passed. Some of my young adults being excited about my Care Bears that were in my office. I would like to know more about these Care Bears.
That's great.
Okay. New puppy, camping with my family.
Nice. Is there anybody okay, I see it. Ebony, I think I see the Care Bears a little bit. We have a whole variety.
Oh.
Loving it. So thank you. I mean, please add more in the chat. Do we have any more?
Learning watercolors.
Good. Bianca, did you have one? Did you have anything that brought you joy? Recently?
For me, when I thought about that question when we were doing this, for me, it's being still. Usually I look for joy in doing things and getting something out of it and not being still enough. So just kind of not doing much has brought me joy lately.
Okay.
Yeah.
Awesome.
What about you, Malik?
I would say I got a chance to get up kind of early this morning and had a pretty good view of the sun coming up. And I think for me, just having that quietness and that time was great for me to get the day started. So just something that I was looking to get a little bit of reading done, but wind up watching the sun a little bit more than the reading. So that was a nice unexpected joy. So with that being said, wait, do I have somebody wanting to use their voice, or maybe they jumped in and meant to mute?
If anyone would like to speak, you can use your hand emoji or unmute. I'm not seeing anything, Malik.
Okay.
Thank you.
So looking at this next slide, right? So let's get into SERC's mission and vision. As we understand that SERC's core purpose here, when our mission and vision is SERC provides resources, professional development, and a centralized library for educators, families, and communities. We work in collaboration with the Connecticut Department of Education and other partners. When we think in terms of our vision, right, the three core pillars that we have at SERC are going to be equity, excellence, and education. We believe all students deserve opportunities that reflect and respect their differences and abilities. We work to eliminate opportunity gaps by addressing institutionalized racism and fostering equity in education. And as you can tell in the climate that we are in education and in a lot of places, this can have us coming, especially more recently, under fire. But at the same time, we have to navigate those spaces and understand the work that was needed in 2024 when our students needed us. They still need us today, and we're still here and willing to do that type of equity work and understand the inequities and the systems that our students, our families, our communities have to deal with. And we're still doing the work, right? And we're still standing. So with that, at SERC, we define equity, right? Not just providing the same thing to every student, but giving students what they need to thrive, right? I think what I love to say is that for me, if you're going to, buy me a size 13 pair of Jordans, which anyone here can, um, I would say that those Jordans might not fit Kelly, who you know, uh, probably was a different size than me. Yes, they're sneakers, but Kelly would need the sneakers that she needs in order to be successful, right? So we're giving our students what they need to thrive, what they need to not just survive, right? Our work actively seeks to eliminate those gaps, and I think that when we do that, we partner, right? Not just ourselves, but with just other organizations who really believe in transformative work and how important that is. And we also provide technical assistance and resource hubs and other things that allow us to do that. Um, who are we, right? I would say SERC is unique, right? We're not this state agency. We're not this nonprofit. We kind of sit in this middle space, right? SERC is a quasi-public agency that partners with the Connecticut State Department of Education, schools, districts, and communities. With our 50 years of experience, SERC is a hub for professional learning, technical assistance, and equity-centered resources across all educational levels. We are facilitators of transformation, supporting sustainable solutions and meaningful change. If I could just say, sir, we really serve as a bridge between policy and practice, between research and lived experience, between systems and the communities that we serve. Our consultants bring expertise in special education, in universal design of learning, in racial equity, and cultural responsive practices, and restorative practices, and family engagement. We have early literacy. So there's so much that goes on that we do there at CERC. But perhaps more importantly, what we bring is a passion for student-centered, justice-focused work. So as we continue through this presentation, what you're really going to hear from us is our approach and how it shapes every project that we take on, right? That approach. We're not just looking to support compliance. We're striving to support courage, innovation, and lasting impact in the work that we do. So whether we're working with administrators, community partners, clinicians, educators, right? Know that CERC is here to walk alongside those partnerships and bring our experience and our deep vision for this work. Bianca, do I have anything in the chat or any questions or anything in there?
Nope. I did just remind anyone at any time to definitely put something in the chat or unmute or raise your hand, but not yet.
Okay, perfect.
Yeah.
So looking at some of our core focus areas, right? So some of these, and we're talking about these 6 right here, but there's more that we do. But looking at racial equity, special education, family and community engagement, cultural responsive practices, prevention and student support, disproportionality and compliance support, right? So as we look through that and we're addressing, so we're addressing how we can interconnect these, how these things are influencing the students and communities and partners that we're working with. For example, we know you can't address student support without also addressing disproportionality and family engagement, right? So through these focus areas, we align with state mandates, we respond to national priorities, and most importantly, we meet the real needs of schools and communities. Each focus area informs the other, enabling a comprehensive approach to educational equity. Whether we're facilitating a restorative practices workshop or supporting an IEP compliance, these focus areas ensure services are grounded in research, inclusive practices, and systems transformation. So sometimes we're facilitating things with student advisory groups, and other times we're running programs with superintendents and or traveling within the U.S. to provide support around national ideas around educational equity or educational policy. So with that being said, SERC and CSDE, the State Department, the Connecticut State Department of Education, we have a very long and strong partnership where we are not a state agency. However, they do help fund us, but by us being quasi-public, we have our own governing board, as well as the opportunity to receive funding in terms of local education. In terms of contracts and local education agencies and nonprofits and things of that, but also federal and local grants. So with that, right, but we get a lot of our funding through CSDE and that relationship there. I would say a lot of times we're the hands and feet of some of the, or a lot of the ideas that they have. So with that, our collaboration includes when we look at special education and we look at indicators around disproportionality. And where we look a lot about in that is that I remember I had gotten trained back in like 2011, 2012 with CSDE around disproportionate minority contact. And I think it kind of transformed into this component here around disproportionality and looking at the indicators that we have. And that's very much quantitative and looking at the data points around why are certain identities or certain groups of our students um, so high or are higher than average that deal with, like, especially our special education students. Why are they having a hard time within, maybe it's racially, and there are special education students, maybe it could be gender, it could be looking at like multi-tier supports, and maybe the school system needing some support around that. And we host, and we're even working on that right now actually for September. We host events and conventions and coaching workshops for educational agencies across the state. And that goes into like some of our equity labs and us being able to utilize. The other part is that at SERC, we moved from Middletown to Waterbury. So now that we're in Waterbury, we have this really nice building. And when you come down there, you can see us right off the highway, and we have a training facility now, right? And with that training facility, we're able to host and have roundtables and bigger discussions, and we invite partners to come and be able to utilize the space and for us to work in collaboration in that. And then looking at the IDEA compliance, that's probably the biggest thing that we support at SERC, because SERC, before we were the State Education Resource Center, we were the State Special Education Center, and that was our original formation, right, about 50 years ago. And then we transitioned. So we still do a ton of, compliance around IDEA, and that's a lot of obviously federal funding, state funding, but just like IEPs, making sure, special education students are receiving the funding, and that educators and school districts are staying up to date on cutting edge and compliance around the services that those students receive. and then really tapping into our professional learning and how important that is in terms of how we support whether we're scaling work, whether we're just providing technical assistance, whether we're coming in to do a training, or we're just doing program management, right? We are really like, how can we really help and embed ourselves across the state in that, or in helping develop new policy or creating new policies? And this collaboration model that we have and this partnership, I think really has allowed us to intentionally design work and do things that connect and create shared responsibility and accountability when it comes to getting the work done for our special education students, our students from historically marginalized communities, and then also like family engagement and things of that nature. Bianca, do you have anything to add?
Not right now, no.
Okay, so with that being said, getting into some of the special education services that we have here, if we're looking at the technical assistance to districts, as long as I think I talked a little bit about the IEP quality work that we're doing, the training and coaching, looking at the inclusion and UDL being universal design of learning and the support that we give there, and the transition planning and compliance support. This is just us niching down in terms of what we're really looking at for our students, because we know that when districts face significant disproportionality, we come alongside them to really help with the equity tools that they need, especially when in terms of special education services and how we can really help with that and how that we can connect those things. Um, so thinking of the coaching teams that we have for IEPs, or looking at the focus that we have for practical strategies and sustainability, um, we focus really on working side by side with districts to help build capacity for them, and not necessarily have us do the work directly, direct services, but supporting the district and their capacity, and reducing the silos, right, that people work in, elevating the voices of students and families. We also provide coaching for effective transition planning, that UDL support that we're talking there, also helps with inclusive classroom practices. And we know that these supports are not one size fits all. We personalize everything, because real equity in special education means building systems where every child, regardless of disability, has full access to learning, right? Full access to dignity, full access to belonging and mattering across their full educational journey. What we've been able to do more recently, even some stuff around dyslexia awareness, that I was able to be a part of last year, and that was really, really nice to have the support from the state, some of the local colleges, and really some of the work there, and also utilizing student voice. We brought in current students with dyslexia. We brought in previous students in college, so that they can bring a voice to this, right, and bring awareness to the ways that were successful for them, but also other ways that where they were hurt and harmed from home and at school, right? From their nonprofits, youth service bureaus, or other agencies that they worked with, so that we can build capacity in terms of how we serve them, right? And how important that is that we provide awareness to that. Um,
Quick
so
Malik,
question. Quick
yeah.
go
question,
ahead,
Malik.
please.
Yeah, Jennifer's on it. There
In
was a
the
question.
chat, there was a question for you. What age does your coaching for transition planning go up to at this time?
Ooh, well, I know we just lost Missy, Bianca.
Yes, we did.
But I believe that we still, I believe it still goes up to 18 to 22.
Yes. Yes, through 22. And that's the age range, but again, when we have these, I guess you would say partnerships or contracts with the districts, it, like Malik said, we tailor it so you can have a focus, even though this transition and covers that age range, you can have a specific focus of the age range, because they're trying now to do it earlier and earlier, even before high school. So it all depends on the needs of that specific district or school that we're in. And address of the location.
Oh,
Of
yeah, well, it's 175 Union Street,
Oh,
Waterbury.
yes. And in a second, we're gonna get to some resources where a lot of that information will be. But just for now, I'll go ahead and put it in the chat.
Yeah, I mean, if you go to we're near Brass Mills, but if you go, they have the new Burns and Co factory come in across the street from us. So,
It's the old Timex building, right? Is that what it is? Timex
yes,
building? It has like a
yes.
big clock on it. You can see it from the highway. It's a beautiful building. Definitely come and visit us.
Okay. Well, thank you for asking the questions. That helps save me as well. Um, all right. So with that being said, really addressing the disproportionality, right? Support to districts with significant disproportionality, and then really looking at the that when we come alongside and we're really reviewing, I think maybe I could add this part here around we facilitate data reviews. We engage stakeholders and help create improvement plans that are both equity centered and actionable. Disproportionality isn't just a compliance issue, it's an equity issue. It often signals deeper systemic barriers affecting students of color and those with disabilities. Our process goes beyond the numbers to uncover the root cause of disparities in discipline, in identification, and placement, right? And I think that part of the root cause and not looking just as right the behavior or the consequence, right? But getting to the antecedent and us being able to use data, and because I know so many times we can get stakeholders to tell us stories, to tell us more qualitative information, but it's also important that we match that, right? With kind of like a mixed methods in terms of being able to guide the conversation with data, but then also being able to right, we're using data as a flashlight, but not as a hammer.
Hmm.
I think that's important too, right? Guiding conversations and change without shame or blame. Ultimately, the goal is to build sustainable, equity-informed systems that meet every child's need.
Malik,
Yes.
Kelly had a question. When you are working with districts on these reviews, on the data reviews and the cause analysis, I'm assuming Kelly, right?
Mhm.
Who are we meeting with specifically? Board of Education, superintendents,
Ooh, I love that.
principals? Tell us more about who from the districts is included in those processes.
Great. When
Yeah,
we're
good
able to
question.
when we're able to go towards the original data review and get into districts and look at and work with them one-on-one with our TA, we're able to go and get more stakeholders to the table. So I think more of even from whether it's family and student voice, getting people from the Board of Ed, getting people right, other those stakeholders, but specifically CSDE has a compliance that like you hit a certain number. So then when we meet with you, we try to get as many stakeholders within the school itself. But a lot of times what we're getting is that because we're equipping them, we're getting a lot of, we might get some lead teachers, but we're getting a lot of administrators. We might get directors, right? People in positions where they have the autonomy to then go and teach. So almost like a trainer and just being like, hey, this is how you get to a root cause analysis. This is how we create systems wide change, and then allowing them and helping them build teams within like, hey, do there's other things that you might need or other people that you have the bus, but who's on the bus and what seat do they have on the bus? And maybe people needs to change. Maybe you need some people to change seats, and then maybe you need some people to get off the bus. And that's kind of sometimes like the phrasing or analogy that we'll use. All right, getting to equity-centered prevention supports. Bianca, do you want me to keep going or you want to jump in?
I can take it. Let me just, because you're still sharing your screen, I have some stuff in front of me. So in expanding on our mission, including our equity center prevention supports, So embedding equity and SEL, mental health and prevention. And I'll talk a little bit more about that when I talk about the school-based center, but making sure that our practices are culturally responsive, right? Making sure that we're informing our practices with the specific context demographically, developmentally, the environment that we're including that in all of our responses. Trauma-informed and restorative approaches, and then addressing the root causes of disengagement and school push out. So when we think about the prevention supports that we embed in all of the other efforts that Malik was talking about, we're always embedding this in all of those efforts, but then specifically in the school-based center for prevention. So when we talk about that, Malik, can you go to the next one?
Yes.
So when we developed the school-based center for prevention, education, and advocacy, we thought about the SERC lens, right? So this was a collaboration that happened almost, I believe, Kelly, tell me if I'm correct, 8 years ago, 7 years ago. It's going to be a long time. But it was really about taking the mission of SERC, taking our relationships with schools, our position as a statewide agency, touching the many facets that and areas that Malik talked about, and then taking prevention science and bringing it into the schools and seeing how that aligns with all of the other efforts that the schools are doing. So eventually, go ahead.
No, Bianca, if I could add something, I think something that I've got a chance to learn from you, and then also, whether it's work with Kelly, work with that we've been able to do with this prevention work, is that we can use some really cool, like really important buzzwords, but it's so important that like the conversations that I've gotten by in learning and building capacity in this is that we go deeper. Right. We're like, why are we doing this? Because we're really addressing the root cause of disengagement. Right. We look at the ways in which like our students, our families, like the things that are really happening, like the state going in and being like, hey, this is a crisis that we're going through, but not just responding to a crisis, but being able to prevent harm and create systems. And because it's right, and we can get so caught up in reactionary services, but it's like, how do we get ahead of it, right? How many times do we hear that story and we're like, how do we get to the babies above the river, right? Versus just like, right, like catching them in the water, and then being like, how do we also not do this in silos, and how do we do this in groups? How do we have healing center strategies, right? How do we have restorative strategies? How do we really embed these things in redesigning policies, practices, whose voices haven't been amplified, and finding those voices, staff wellness, right? And how that's come up. And just really thinking about the community partnerships and how we can do this together. And that this work doesn't look like extra, right? It is so important that it is something that isn't extra. It's just something that needs to be embedded.
Yeah, and that's something I always mention when people talk about SERC and what kind of positions us differently is our systemic piece, right? And how we go in and we support districts and schools and the school community and looking at everything they're doing, all the federal mandates they have, the local mandates, the school mandates, the family mandates, everything that you have to do, and making it, synthesizing it and making it all work together, rather, like Malik said, than doing it, separate from each other, which we know does not work for a variety of reasons. And so learning about how prevention, the schools learning about how substance use prevention specifically is integrated in the work of embedding SEL, mental health, culturally responsive practices, trauma-informed and restorative approaches, learning how to plan your prevention planning around that is really what we're going in and doing. So the school-based center is just a centralized space, literally, where we have all of the resources for you for your school-based prevention efforts and with your community partners as well. And so it's just one place where you can access all of that information. And we do that through our library, and we do that through our support through our consultants, such as Malik and I. So we would go in and we would support prevention planning using some tools that were developed earlier in our work together. And the tools really help assess the gaps and strengths in your school, in your context, right? Because thinking about equity And what Malik mentioned, that not one size fits all. We need a tool to be able to assess where you're at, and what you're doing really well and what you need a little bit more support on. So we do that level of technical assistance and support and coaching. And then we do just kind of a more broader support in helping you find a program that is appropriate for your school, for your district, for your community organization, or helping you navigate the library, or just going in and, you know, talking with you about what supports you may need and how we can support you. So there's various levels of support that we provide through the school-based center at SERC. And so I will, at the end of this, put some resources. I guess we're going to go through that next, Malik, unless you wanted to add anything. But I'm going to show you really quick because I think it's important for you to just see the website with our tools for the library resources, which is a big part of the prevention center. And also adding that when the librarians curate the resources for the prevention collection, they're very intentional about not duplicating what is already in the state, what is already at Clearinghouse, one of our resource links partners, and that they are authored by family members, social workers, people who live in or work in the community. And so it's a very, they take their time to be intentional about making sure that it sits on its own, right? That it has its own unique curation. So if you can go to the next slide, Malik, really quick, or I'm gonna share my screen. Let me just share my screen real quick.
Okay, I will stop sharing.
And I will just take 2 seconds just to show you really quick how to navigate this. Give me 1 second. Okay. Tell me when you can see the library. What can you see on the screen?
Nothing yet, madam.
Nothing yet?
Nope.
I don't know if this is gonna work. Okay. This may not work. So this is not working, so I'm gonna just keep keep going, but I'm gonna drop in the library address. When you go into the library address, all you have to do is go into the collections. Oh, there you go. Thank you, Malik. So you have to access the library, SERC library catalog. You go to the bottom or on the top as well. And then there you're gonna see all of the collections. So if you want to sign up for a library account, you can do that here as well. And then explore. So this is where you're going to see explore a collection, the CERT guides. You're going to see we have a racial equity collection. We have one for LGBTQ plus. We have one for children, just for families. Then we have the prevention, education, and advocacy. We have a section with all of our tests and assessments, games and activities, kits, and then all of the various languages that we have that we've been building on. So as you can see, they organize it in a way that is user-friendly, and that you can, you know, explore it and know exactly if you want something specific, you have access to just that specific population. There's also a section where there's programs and curriculums, and you can search by age, developmental stage, if you can implement that in a community, a school, if it's a promising practice or an evidence-based curriculum. So that I have found helpful as well when I'm working with schools, and schools typically go in there and navigate it in that way. So when you have a chance, definitely go in there and explore. You have to either live in Connecticut or go to school in Connecticut or vice versa to be able to get a card. Or if you are on the CERC actual at our building, then you're able to access any of this without having a card. So if you ever came to visit us, you wouldn't need a card to access any of this. So yeah. And then if you go to the CERC main page, You'll find a lot of resources as well, such as our statewide trainings. There's an area for you to request space. I know that we had talked about using our space. So that's there as well. And also if you go into about and you go down to reports, you will find our annual report from last year, this and the year before. So if you wanted to kind of take everything we talked about today, but look at a big picture snapshot and digest the information differently, this is a great place to look and to check out our 23-24 annual report. And it'll, like I said, provide you a snapshot of everything that we've done for the past year, all the areas with the state, special education, with DMHAS, with families. So that's a great resource as well to learn more about everything that we've been doing.
And most of you know our fearless leader, Ingrid Kennedy, or Dr. Ingrid Kennedy, and the work that we do has her fingerprint all over it. In terms of her support, in terms of her leadership, and how she her commitment, right, as a passionate leader. So we have that.
Our board members are there, requests for proposals. I mean, this is a great place that if you're just starting to learn about us as well, that you can navigate.
And then we will have more opportunities coming in terms of professional development and things that we're going and what we've been doing from our events page as the school year gets going in the fall. But if you come here, please join our email list. We go through some of the services that we talked about on the website, resources, and things in the news and things that we're involved in and doing. And then also we have the SERC Foundation, which is also something that we get to do some really amazing work, especially with the Graustein funding and some of the work that we do around community coalitions. And we've been doing some stuff out in Southington, and we did some work in Glastonbury, did some work in Weathersfield. We did a lot of work in Weathersfield. It was like kind of like our flagship program that's really flew and is still going, which is awesome. And then our Dismantling Systemic Racism conference that we put on every year, and we just completed one with the focus was on centering, healing, and wellness. And we had some really phenomenal speakers that came in this year, and then facilitators. So we're always looking for people who have phenomenal that have alignment with what we're talking about in terms of the theme and dismantling systemic racism. So if you ever think of bringing in a innovative idea that could be something that we have as a breakout or as a presentation, please know that we are open to that, and we'll be sending if you're on our email list, it's easy to know, but we'll be sending out that information looking for collaboration amongst that, right? And how important that is. And then also I wanted to add in, like, come see us, right? We have the address in there, like, stop by. I know the library isn't open on Monday, but Tuesday through Friday, come see us. I think the best time is probably between 9 and 3. But come see us, come get yourself a library card, come check out some of the things that we can do there, and even how the people, our colleagues in the library can really support some of the things or ideas that you might have going on or what we already have. And we have a lot of really great material and stuff for families, for schools, for maybe clientele that you're working with.
Yeah, I was going to add, I see some school social workers on here, and that's one of the areas that we're going to increase our outreach to is you can come in and you can, take out these wonderful kits that have been curated, games, activities, kits. There's even if, letting families know to bring in their children with them. There are areas that are developed just for the children to sit, to lounge, to do activities, interactive activities. Or if you just wanted to take out, like Malik said, some games or activities to work with your students, your kiddos, or if you're an undergraduate or graduate student and you wanted to take out some stuff to support you have an internship. So there's so many resources that we have that we're trying to ensure that people know about and use and access.
And I think a quick example for like the library is that like Bianca and I are recently creating some curriculum work, right, around prevention and looking at the idea of like screen, how do we create screen wise parents and kids, right? Utilizing some of the information that we got from the Ancient Generation book or the Social Dilemma video on Netflix and other research-based things that are telling us about, screen devices, social media, bots, things of that nature, and like how, and we're creating those things, but we're also working in tandem with the library to help provide us with more research-based, more evidence-based things that we that they can help support us on as we're creating programming around that, and then being able to work in collaboration. So like that has been like a great resource for us in terms of just their skill set and the things that they have going on.
Kelly asked about if a prevention coalition was having trouble engaging populations in their community, would you be able to assist them on strategies? I can go first and say that the first step that we could definitely support them with is maybe figuring out why, right? The root cause of the lack of being able to engage before we would kind of move on to some strategies is maybe helping in that assessment process. That absolutely will be somewhere where we can be of support. Malik, I don't know if you wanted to add anything else.
No, I think you brought up like our main focus when we get in is to do that type of work and then get into like, what are the interventions or what are the systems that we're looking at and how we can best support.
Mark, what circumstances, if any, does the root cause analysis use student survey data on substance use? Does the SERC consulting teams point out to districts that do not use a student substance use survey that is a gap? To what extent is SERC involved in developing current substance misuse prevention curriculum and activities for health educators on all levels? Thank you, Mark. Those are very meaty questions. I know that I can automatically answer that third one. To what extent is SERC involved in developing current substance misuse prevention curriculum and activities for health educators at all levels? So I'll let Malik discuss really quick about the development, but a lot of our work is not about developing prevention curriculum. It's about supporting the selection of the correct and appropriate curriculum for your specific context and developmental stage and demographic and all of that, which sometimes people don't use an assessment tool and they just pick any program based on what somebody heard at a conference or based on what the mandate is or the guidance is from a federal level or a state level. And it doesn't really address the specific risk and protective factors of your communities. But with that being said, Malik did mention that we are developing some, I'm thinking about developing some prevention curriculum in specific areas. I don't know if Malik, you wanted to expand right now, or we can.
Yeah, I mean, just would go with like Mark, of course, like we having student and family voice is extremely important in doing this, because what we sometimes get is like we'll get youth whisperers versus going to youth themselves, and it's like you have to go to the primary source. And then we find that whether it's with substance abuse or in other facets, that like when we go through and talk and have them go through some of our survey questions and stuff like that around how their systems are built, when we see those gaps, we point them out. Now, obviously, we can't make them do this, but like do things, and we've experienced that. but we definitely call to attention gaps that we see in terms of being able to add that type of information, and then how do we then bet, because like how do we, as a best practice, right, and how do we best support the school districts from there in terms of substance misuse and prevention. And I think that's a big reason why Bianca and I are starting to think this summer around what are maybe some more curriculums and things that we can talk to schools about, because we often find ourselves starting with prevention science and
Right.
getting into like how do you really like have the systems in place and build teams, but also getting into like, hey, what are we hearing from schools, what are we hearing from families, what are we hearing from students in terms of programming that we need to create.
Which districts would you, this is from Mark as well, which districts would you consider ahead of the curve or stronger in terms of implementing best practices for substance misuse prevention strategies or health education curriculum? That's not something until I look at, the data that I would be able to, because it's also what we consider stronger and how we define that. Because that is something that has to be, I guess, talked about first, is what we're using to consider it ahead of the curve or stronger. But Mark, I would love Malik and I to also meet with you, or anyone else, to continue to flesh this out and really go deeper on these questions. I think it's a great opportunity, because they're wonderful questions, and I think they just need a little bit more time, to kind of reflect on and answer. So I would love to set up a time. I'll email you, or you can email Malik or I. But we can definitely look at that.
And then the best thing about that is that even if we can't share like what district it is, we can always share practices.
Right. And also I want to add that on the prevention website, which we did not show you, but I will send to you as part of the resources, Malik and I will send that to you. There is a data tab. And in that data tab, we had conducted a survey on what districts are implementing, what programs what substance misuse, mental health programs they're implementing, if they use an assessment tool to implement it, if they think it's working or not, what what tool they're using to assess if it's being implemented with fidelity. So those questions are there. And when we first started the survey, I believe we had almost 70 districts answer it, and that data is laid out. And that may be a good place to start to kind of answer that question. Who's doing what? And at what level, and how are they selecting what they're doing?
So I know presentation wise, we talked about the events tab, and that will be updated moving into the fall. So really just adding once again to the supports that we give, and I think a focus that we really do provide that maybe is different than just training is the technical assistance. So the ability to work with districts and meet with their leadership, or to talk and review policy. So whether we're looking over website design, or we're looking at how they're acquiring survey information, or we're looking at just coaching up leadership in terms of going from reactive to prevention. There's a lot there. And then having the training and coaching for that. It's not just one-to-one, sometimes it's one to like a smaller group or some type of team that we're working with to help once again empower them so that they can empower the school building or the district with that information. And then taking that strength-based approach, research-driven, and really establishing those longer relationships. And here again, I think we'll be sending out this presentation. So we just want to make sure we provided you with more access to contacts that we had, and our visibility online from even if you wanted to stay up to date with a lot of things that we do via Facebook, and then also things that we do via LinkedIn. We have Bob who does a great job of keeping us posted and relevant in terms of people updated in the things that we're doing from our prevention work to fatherhood and literacy to special education to equity work. So there's a ton that we get to keep posted on there. So if you want to follow us there or connect with us that way, that is great as well. And then some final thoughts, right? SERC is a prevention partner grounded in equity, right? I think that's trying to keep things simple. And we would love to collaborate to build inclusive, responsive learning environments, especially, right? Because I know we really niche in that, but we also expand in terms of how we can support outside that. But like, you know, excellence in education, right? And equity is what we do. And really any additional questions, I appreciate the ones that were given and the ones that we were able to answer or hopefully be able to follow up with.
Malik, I didn't see your email address or Bianca's email. Is that in the actual presentation currently? Was it in the front? Okay, just when I send out the slides, I just want to make sure your contact information was in there. Go ahead.
I'm so sorry, Jennifer, is there any way to save this chat?
Zoom should.
Okay.
So I'll see if I can download that and send it to you.
Yeah, there was just really a lot of really good questions that I don't want to lose, specifically the ones from Mark that I kind of want to reflect on.
Sure, no problem.
Yeah.
So we just have a minute or two left before we get into any final thoughts or thank yous. I just want to remind everyone I will send out the materials and the recording of today's for those who weren't on quite at the beginning. So I will be sending that out to you along with instructions for your CEUs and how to get that for attending today. And on behalf of TTASC, the prevention ecosystem and everyone that you serve, we thank you for your time, Bianca and Malik today and agreeing to be present with us here today and sharing all of the opportunities that exist in collaborating with SERC and everything that you do for our state and in the communities in which you serve. So thank you very much for being here. And with that, we do have a minute or two if anyone has a final question or two. But if not, we can end our recording and wrap up for the day.
Thank you, everyone.
All right, I don't see any final questions. So thank you again, everyone, for being here. We'll be in touch shortly, and we look forward to seeing you again soon. Thank you so much.